Hello, I'm Simon Whistler. You are watching TopTenzNet, and in the video today, we're going to look at the top 10 craziest mental disorders. Throughout history, mental disorders have been regarded with fear, bias, and ignorance. Though medicine has drastically improved for the mentally ill in the last century, mainstream society still has a relatively uninformed and biased view against individuals with mental disorders. This is particularly harmful because every year up to 1/4 of Americans fit the criteria for being mentally ill. The media has done its best to show us the crazy sides of the mentally ill, but how crazy is crazy? If 1/4 of the population are crazy, how dangerous is society? In today's video, we count down the most life-interfering disorders and explore how they fit into our everyday lives.
The top 10 craziest mental disorders. Number 10. Type 1 Bipolar Disorder. What it is. Bipolar disorder has been talked about a lot. It has received vast media coverage, and most individuals have at least a general idea of what it is. Bipolar disorder makes an individual switch between two main moods: mania, emotions like happiness and anger, and depression, emotions like sadness and guilt. Unlike the media interpretation, bipolar disorder's mood swings actually take a long time. Each swing lasts about a week on average, with a few days transition in between. Bipolar has been known to cause psychosis in some patients, but for the most part it manifests in irrational actions, heightened emotions, and lack of sleep during mania, and tiredness, aches, and lethargy during depression. Patients often have very little self-control and are at the mercy of their moods. How it fits. 2.6% of the adult population is bipolar. The disorder is genetic and is generally easy to treat with medications. In some cases, therapy isn't even needed. The biggest risk is unmedicated patients who often do harm to themselves. Unmedicated bipolar disorder has a 25% suicide rate, and sometimes they will also harm those around them. Number 9. Obsessive-Compulsive Disorder. What is it? OCD is another widely known disorder, but very few understand it. Firstly, OCD isn't an obsession with cleanliness. It can manifest in being clean, but that's only one aspect. Obsessive-compulsive patients are often plagued with recurring thoughts, worries, and fears that can only be relieved by repeating tasks: cleaning, touching surfaces, making noises, etc. Obsessive-compulsive individuals can realize their fears are unreasonable, but the anxiety will keep mounting unless they relieve them by repetitive tasks. How it fits. 1% of adults have OCD. Psychiatrists haven't figured out the cause of OCD yet. Some think it may be caused by environments, others by chemicals in the brain. The treatment varies per patient, but is generally manageable through psychotherapy and certain medications. OCD patients are not really dangerous to others, but their lives can be difficult, and their behavior may seem odd. Number 8. Factitious Disorder. What it is. Factitious disorder is an obsession with being sick. Unlike hypochondria, in which patients actually think they are ill, individuals with factitious disorder intentionally make themselves sick or play sick for attention. They often tell elaborate stories about medical complications, visit hospitals, tamper with their medications, or inflict harm upon themselves for attention. How it fits. Factitious disorder is rare in adults and occurs in less than 0.5% of the population. The disorder stems from past trauma. There is no cure or treatment for the disorder, though psychotherapy can be effective in limiting the behavior. Most individuals with the disorder are not receptive to treatment. Number 7. Schizoaffective Disorder. What it is. Schizoaffective disorder is a bizarre combination of severe bipolar and mild schizophrenia. Patients will have manic and depressive mood swings, and as a third swing, they will lose touch with reality. Most often, schizoaffective patients will have extremely low emotional responses in the third psychotic state. They can become delusional and sometimes may hallucinate. The psychotic swing is mild in comparison to most psychotic disorders, however, and can often go unnoticed, leading to a misdiagnosis of severe type 1 bipolar. How it fits. 0.5% of Americans have schizoaffective disorder. Psychiatrists believe the disorder is genetic and chemical. The disorder is relatively easy to treat with combinations of medicines. Most people with the disorder can function normally in society as long as they are medicated. Like bipolar disorder, schizoaffective disorder has a very high suicide rate when untreated. Number 6. Depersonalization Disorder. What it is. Depersonalization disorder gives individuals a sense that they are not in their body. Individuals will feel like they aren't their physical self, or that their life is some sort of movie or dream. They struggle to form connections with people because they don't feel as if anything is real. They have the ability to logically know they are ill but cannot shake the feeling of detachment. How it fits. Depersonalization is also very rare, affecting less than 0.5% of the population. It is caused by traumatic events. The reason depersonalization is so crazy is because there are no treatments. No medications are effective on the disorder, and psychotherapy seems to only help some patients, but not all. Some people will feel detached from reality for the rest of their life after a traumatic event. Number 5. Trichotillomania. What it is. Possibly one of the most physically disruptive disorders, trichotillomania is an obsession with pulling out hair. Individuals with this disorder will constantly pull out body hair, eyebrows, and eyelashes. Patients get overwhelming urges to pull out their hair, only reaching relief when they've done it. Individuals will go to great lengths to hide their bald spots, but for some the disorder becomes too bad to cover up. How it fits. Trichotillomania is also very rare. No one knows what causes it, but it is possible to overcome through psychotherapy. Some cases also benefit from medication. People who have the disorder may be feared because of their appearance, and it's not uncommon for them to be featured on daytime talk shows. Number 4. Specific phobia. What it is. It seems strange that phobias rank so high up on this list, but they are where they are because they can be so interfering with lives. Most people think a phobia is just an unease or mild fear of an object. Actually, a phobia is an unmanageable terror of everyday things. There are many subcategories and specific names for different phobias, but they all fall under the same disorder. Phobic individuals will go to extreme lengths to avoid their unreasonable fears. They can experience physical symptoms such as racing pulses and strained breathing if exposed to their fear. How it fits. Phobias are incredibly common, affecting 8.7% of people. They are caused by traumatic childhood events. Most of the time, the patients can't remember the event. The most common techniques for treating phobias are exposure therapy, in which the patients must confront their fear slowly and with the guidance of a psychiatric professional, and hypnotherapy, which helps patients to remember the cause of the fear. Patients are able to recover, and even untreated patients may blend into normal society. Number 3. Antisocial personality disorder. What it is. Amongst the most basic, common, but dangerous disorders, antisocial disorder is also known as sociopathy and psychopathy. Individuals with this disorder have no empathy, leading to no morals or no emotion at all. The ones who have emotion but no empathy are extremely dangerous. They make excellent liars, are often charismatic, and feel no remorse for any harm that they cause anyone. Their brains simply can't make the connections to evoke empathy. Because of this, they can do terrible things without a care. As you might imagine, most antisocial patients become involved in crime. A majority of serial killers have been diagnosed with this disorder. Some individuals, especially the emotionless ones, are able to fit into society without causing any harm, but can never relate to people on the same level that normal individuals can. How it fits. 1% of Americans have antisocial personality disorder, but only 50% treat it. A majority of people with the disorder end up involved in crime. There is no cure for the disorder, and the only treatment is to teach the patients to act normal, although they'll still never be able to grasp ethics or even emotion. Number 2. Dissociative identity disorder. What it is. DID, formerly multiple personality disorder, is a very severe disorder caused by severe trauma. An individual with this disorder will split his or her personality into 2 or 3 different identities and cycle between them. A 50-year-old man may think he's a 6-year-old girl and spend his time playing with dolls and wearing dresses. This disorder has also had a lot of media coverage, but is very misunderstood. Individuals with this disorder rarely take on more than 3 identities, and it's almost impossible to make them aware that they have it. They cannot live normal lives because they may switch identities at any point, sometimes staying on an identity for years, and sometimes for hours. How it fits. This disorder is also very rare and can only be found in about 0.1% of Americans. There are no medications to fix the disorder, but hypnotherapy can be useful in merging the identities. Patients cannot live in normal society unless they have gone through extensive therapy and their identities have been merged. Otherwise, they live in psychiatric institutions or they are constantly cared for by family and friends. Number 1. Schizophrenia. What it is. Schizophrenia, in short, is a loss of reality. Symptoms include inappropriate or few emotions, paranoia, obsession with media, false beliefs about the body, beliefs of being famous or powerful, auditory and visual hallucinations, and catatonia, a completely unaware and unresponsive state. Unmedicated schizophrenics can't tell what is in their head and what is real, leading them to act strangely. There are different levels in the loss of reality, and some are able to function normally for short periods of time. How it fits. For such a severe disorder, a giant 1% of Americans have it. This means that for every 100 people, 1 is a schizophrenic. Schizophrenia is very genetic and is often treatable with medication. Most medicated schizophreniacs are able to function completely normally as long as they take their medication every day. The disorder will never go away, and just skipping one day of medication can jeopardize the patient's sanity. The crime rates of schizophrenics are actually not as high as other disorders, but the individuals are much more troubled and much further from reality.
So thank you for watching. I really hope you found that video informative. We put out great stuff like this 7 days a week. There's a subscribe button below me right now, so just click on that and you'll get brand new stuff every day in your feed. We put out stuff at 6 p.m. Eastern Standard Time every day. Also, if you did like this video, do give it a like and be sure to check out a couple of our other videos. We've got the top 10 unusual places thought to provide healing, which is kind of a bizarre one. And then below that, you'll see the top 10 internet illnesses. And this is a bit weird, but it's diseases that are very associated with internet use. It's a pretty fascinating one. I'd recommend checking it out. And that's all. Once again, thank you for watching.